Okay, so I'm gonna argue against some of the stuff Chris said. He mentioned that weed isn't addictive, but although there's a lot of people who say there aren't, studies have shown that it can be. Long-term marijuana abuse can lead to addiction, that is compulsive drug seeking and abuse despite the known harmful effects upon functioning in the context of family, school, work, and recreational activities. Estimates from research suggest that about 9% of users become addicted to marijuana. This number increases among those who start young. And I know they're talking about making it legal for 18 and over, and like for alcohol, you have to be 21. So technically, why would you start at 18 when it could still have negative effects? And then research clearly demonstrates that marijuana has the potential to cause problems in daily life or make a person's existing problems worse. In one study, heavy marijuana users reported that the drug impaired several important measures of life, achievement, including physical and mental health, cognitive abilities, social life, and career status. Several studies associate workers' marijuana smoking with increased absences, tardiness, accidents, workers' compensation claims, and job turnover. Marijuana also, like the smoke, is just as harmful to the lungs as tobacco smoke. According to studies by the University of Notre Dame, marijuana contains 50 to 70% more carcinogenic hydrocarbons than tobacco, giving it the potential to promote cancer of the lungs and other parts of the respiratory tract. So it's kind of like, why would you be using marijuana to help cancer? And then in 2009, 28.5 million Americans aged 12 and older had abused marijuana at least once in the year. And then the NIDA funded 2010 Monitoring the Future study showed that 13.7% of 8th graders, 27.5% of 10th graders, and 34.8% of 12th graders had abused marijuana at least once in the year prior to being surveyed, and that rate's going up. So it's affecting the kids, which isn't right. Chronic marijuana use, especially in a very young person, may also be a marker for risk for mental illness, including addiction, but stemming from genetic or environmental vulnerabilities, such as early exposure to stress or violence. Currently, the strongest evidence links marijuana use and schizophrenia and or related disorders. High doses of marijuana can produce an acute psychotic reaction. In addition, use of the drug may trigger the onset or relapse of schizophrenia in vulnerable individuals. It's known for harmful effects upon functioning in the context of family, school, work, and recreational activities. And then like marijuana intoxication can cause distorted perceptions, impaired coordination, difficulty with thinking and problem solving, and problems with learning and memory. Research has shown that in chronic user, marijuana's adverse impact on learning and memory can last for days or weeks after the acute effects of the drug wear off. As a result, someone who smokes marijuana every day may be functioning at a suboptimal intellectual level all of the time. Also, they were saying how it could help with the economy. But according to the LA Times, you can get medical marijuana, and most doctors don't care if you're actually sick or not. You can be prescribed medical marijuana for as vague as a term as pain. So the doctors are trying to help sick people feel better, and they're trying to help healthy people feel better. But one person said he got his first prescription from a doctor on the side of a boardwalk who claimed you can get medical marijuana. He was recommended by a friend. He had to fill out a normal doctor's office form, but all he had to do was just write he had pain and the doctor gave it to him. He only had to pay $250 for a year's worth of medical marijuana. And then another person said he only had to pay $100 and got an unlimited supply. So it's very easy for people to be able to get marijuana now, so it's not exactly helping with the economy and boosting the economy. It's getting more convenient for patients to use. Dave Levine, an entrepreneur from Ahwatukee, an economics graduate from the University of Arizona, has come up with the cannabis container vending machine. A former vending machine company owner disliked the idea of cancer patients having to fumble with lighters, so now he's trying to make dispensaries that for 24/7 stock with necessary smoke. There's really no way of actually proving you have a medical card for that, so that's another way of like not helping with the economy. They were also mentioned about our prisons, how like our prisons would be freed up without medical marijuana, or without, if marijuana became legal. Our prisons are overcrowded, but not because casual users of marijuana are in prison. Less than 1% of all inmates in state prisons are there because of the use or possession of marijuana. They're in prison because of other charges, some involving drugs, but for sale or trafficking. They're also there because we do not have enough drug courts, which have rates of 16% compared to 45% for offenders not in those programs. They're in prison because of the prohibition system that is ineffective and because we tolerate a high crime rate, have more gun dealers than gas stations. There was also, he said that the gateway, which Kyle never actually talked about the gateway effect, but there are signs. So like for cocaine, 62% of adults who had used marijuana before the age of 15 have used cocaine at some point during their lives. For those who had never used marijuana, the number is 0.6%. For heroin, those who use marijuana in youth are more likely to use heroin. That number is 9% as compared to 0.1% for those who had never used marijuana. And then for psychotherapeutic drugs, 53.9% of those who use marijuana before the age of 15 report that they have tried to use psychotherapeutic drugs for non-medical uses. The rate for those who have not used marijuana is 5.1%. There's a statistical set that is related to the order in which different classes of drugs are first used. Drug abuse rarely begins with hard drugs and regresses to marijuana. A longitudinal study of 1,265 New Zealand adolescents between 15 and 21 years of age revealed only 3 cases in which hard drug use was initiated before marijuana use. The third factor used to support the marijuana gateway effect is the strong correlation between the frequency of marijuana use and the rate of hard drug initiation. A proportional hazards model implied that those using marijuana more than 50 times per year were 140 times more likely to progress to hard drugs than those test subjects using no cannabis. So, yeah.